Dr. Haresh Sampathkumar. I'm a physical medicine and rehabilitation specialist. I did my MBBS training in Chennai at Sri Ramachandra Medical College and Research Institute. I did my post-graduation in physical medicine and rehabilitation in the US, followed by a fellowship in brain injury medicine. I am currently working as a full-time physician at JH Rehabilitation, which I co-founded. It is a comprehensive rehabilitation center that is led by physicians and work with a team of other professionals such as physiotherapists, occupational therapists, speech language pathologists, neuropsychologists, and a social worker and a nutritionist as well. We work together as a team and we take care of patients with various conditions, people who have stroke, people who have spinal cord injury, people who have traumatic brain injuries, people who have amputations, people who have pediatric disabilities, geriatric conditions. So we cover a wide range of spectrum, and what is really unique about us is the fact that it is led by physicians and that we have a comprehensive team approach to these issues. And particularly for these disabling conditions, our ultimate goal is to integrate these individuals back into the community. And we have a separate program for that called Empower, which was launched 2 weeks ago. So that's a little bit about myself and about our institution that I'm currently working at. The topic for today is joint pains in the elderly. So joint pains can happen because of various reasons, but the predominant cause of joint pains in the elderly is because of osteoarthritis. Osteoarthritis is a medical term for a condition where the joints, the cartilage in the joint starts to get destroyed and the bones that form the joint start to be in contact with each other and cause pain, inflammation. Because of the severe pain and inflammation, people are not able to perform their day-to-day activities, and this could be an extremely disabling condition, and it is actually the most common cause of osteoarthritis. There are various other reasons why one may have joint pain among the elderly population, but that is the most common cause all over the world. Now I am ready to take some questions on this topic.
So, thank you, sir. Thank you so much for the introduction. We'd like to ask you, so these joint pains and the reasons, these can be diagnosed and, we might get prescriptions and maybe some exercises to be followed or lifestyle changes. But when it comes to elders and seniors, they may not be readily, they might readily accept what we're saying in exercises, or how to get them to do it, how to get them to follow the lifestyle, and what would be the lifestyle that you would suggest for osteoarthritis as well. What would you suggest? I mean, how do they go forward with moving around and using their legs and hands carefully?
Okay. Well, I think it's a twofold question that you put in one question, but I'll address one at a time. How do we motivate them? I think that's a difficulty that we are facing even in our day-to-day practice. How do we motivate them? It's actually not a problem just with the elderly, but with any population. Well, one thing that is really important is the knowledge. What is the problem and what needs to be done to make it a success, or why is this treatment helpful? So that knowledge itself is oftentimes sufficient for somebody to be compliant with the treatment. Well, if that doesn't work, sometimes you just have to reiterate that issue. Sometimes the problem is practical difficulty. We may, as physicians, we may just recommend a treatment without realizing what is the practical difficulty they have for not being able to comply with the treatment. So sometimes you have to be sort of a social worker. Obviously, we don't have time when you're dealing with a lot of patients, but sometimes you do have to do that if you want to provide the best outcome for your patient. So sometimes you'll have to figure out what exactly is the problem, why are they not being compliant, ask the patient that question, and problem solve that issue.
Right, sir. Thank you.
And what was the second question? It was a twofold question. How do you make them move around?
Yeah, with osteoarthritis pains that they have. How do they actually go about doing their daily work, or just getting some walk or something like that?
How do we get them move around? Well, I would say, once the pain is addressed or once the pain is taken care of, it would be easier for them to move around. The other thing is also they do have stiffness and pain when they wake up early in the morning or when they wake up in the morning, and which usually subsides as the day progresses. They may continue to have pain, but usually the stiffness and pain is slightly worse for the first 30 minutes to an hour in the morning. So, that may be a restricting factor. Oh, I don't want to move around because I'm going to have this day. But it does get better as you start moving around. So the key thing here is function. Keeping yourself active, tolerating the pain will keep you functional, will keep you be independent with your activities of daily living. And if you want to continue to work on the pain, obviously compliance with these various treatment options that is being recommended by the physician is advised.
Alright, sir. We've got a question, and the first person, Ajit, he's asking, I've never heard of rehabilitation for physical illnesses or after a surgery. How does it work? Is it only exercises like physiotherapy? So this question is directed towards the beginning of the live session when you were just talking about rehabilitation. So can you shed some light on that, sir?
What is rehabilitation?
Yeah, what is it and how does it work? Is it only exercises or like physiotherapy, and what is it?
So rehabilitation is actually a terminology that basically means taking them back to doing things that they were doing before. You can only rehabilitate, as the word re suggests, you can only rehabilitate for individuals who've had some kind of problem and there has been a decline in something that they were previously doing. Okay, so that's what the terminology means. So rehabilitation in this context, meaning now they've had joint pain, that is the topic for today, so let's stick with that context. So rehabilitation in this context would mean people who have joint pains, have stiffness, pain, so they weren't able to do the things that they were doing before. So getting them back to doing things that they were doing before is the goal. It can be done with medications, it can be done with injections, it can be done with exercises. It can be done actually even with weight loss. Studies have shown that people who lose about, I think, 10 pounds or 10 kilograms, I could be wrong on that number, but people who lose that much weight actually have shown to have significant decrease in joint pain compared to other treatment options that is being recommended. So for obese individuals, that is actually a big thing. So the point being, what is rehabilitation? It could be various treatments that can be given to help them do things that they were doing before. That's the ultimate goal. So it doesn't have to be just exercise. It could be everything, but exercise plays a big role.
Alright, sir. Thank you, sir. And there's another question. I'm 50 plus. Hema is asking, I'm 50 plus. I have not fallen down or gotten hurt. I'm facing pain in my shoulders regularly. What could be the reason?
Can you repeat the question one more time?
So, Hema is 50 plus and she has not fallen down and she's not gotten hurt before, but she has pain in the shoulders regularly. So, what could be the reason for that?
Okay. Is Hema able to provide more information?
No, sir.
No, okay.
We have to get back.
Well, with the limited information that we have, now 50 plus, one of the common things that happens in women who are in their 40s and 50s is what we would call the frozen shoulder. The medical terminology is periarthritis of the shoulder. If this pain is associated with extreme stiffness, then that is most likely the diagnosis. But again, I don't have sufficient information to say that is the problem. So if that is the case, definitely the most important treatment in that setting would be exercise. Certain type of exercises could be given to treat that pain.
Alright, sir. Thank you, sir. And there's a question from Gayatri. She says, my father has undergone knee replacement surgery. Is it possible to reduce the pain so that he can just walk around normally, move around normally? So her father has undergone knee replacement.
Okay. And the question is, can
the pain be reduced so that he can move around? I'm guessing that her father is not getting up and just walking around, or maybe I'm not sure how long it has been as well.
Yeah. Again, some missing information for me to accurately answer this question, but I'm going to have to hypothesis a little. Basically, if the surgery is done well and subsequent exercises were done properly, the pain should not be there. It's possible a small percentage may have that pain despite being compliant with the treatment, that is surgery and the subsequent exercises. In that case, it is important to find out what is the cause of the pain. It definitely would be a good idea to speak with the surgeon who's done the surgery and find out what could be the cause and what could be done about it. Or if they've already met with the surgeon, then the option is to get a second opinion on what is, and if they met with the surgeon, they didn't get a proper advice that is satisfactory, then they could get a second opinion from another physician, trying to find out what is the problem and what could be done about it. So,
okay, sir. Thank you. And there's a question from Geoff Snehal. Can rheumatoid arthritis be treated? How?
Yes, rheumatoid arthritis can be treated primarily through medications. The medications that we have now for rheumatoid arthritis can significantly control the pain and significantly prevent or limit disability. There are tons of medications. The recent ones are biologics, but unfortunately what we don't have at this time is we don't have a cure for the treatment, but obviously there is a lot of research that is being done in stem cells and all that, but we don't have a cure for the treatment, but it can be significantly treated and controlled, and definitely exercise plays a huge role in reducing the pain as well as maximizing their function. Ultimately, people are even able to live with the pain, but they're not able to live with the fact that they're not able to work, they're not able to live with the fact that they're not being a productive member of the society. So in that aspect, exercise plays a huge role.
Alright, sir. Thank you. And Dinesh is asking, elders fall a lot when they walk and they get hurt. So what is the right thing to do after a fall? Will they be able to walk normally?
The right thing to do after a fall is to make sure they've not sustained, number one, any kind of fracture in the body. Number two, they've not sustained any injury to their head. Both things need to be ruled out, number one. What is the second question?
Will they be able to walk normally after they fall?
Yes, they would be able to walk normally after they fall, provided they've not sustained any of these serious injuries. And the important thing after a fall is also making sure, let's say if it was as simple as a rug on the floor, water on the floor, and that's the reason they fell, it can be addressed easily. But if the reason for the fall is they've got poor balance, they've got other issues, neurological issues, then that needs to be addressed and treated. And if it is an external thing, such as water on the floor, things on the floor, stuff like that, then people who live in the household with the elderly population need to be aware. They're like kids. You have to be very careful about what you put on the floor because they may trip and fall, and they have very brittle bones. They'll easily sustain a fracture. So you have to be very careful with the environment that you have around them.
Alright, sir, thank you. And there's a question from our Instagram follower.
Mm-hmm.
What supplements can be taken to avoid joint pains in seniors? Supplements?
I would say I don't usually recommend supplements. I know there are a lot of supplements that are available to strengthen, to increase the strength of the cartilage, or to people take vitamin D and calcium, but my recommendation from a patient usually is only when those things are deficient, you should be taking it, because right now there is no evidence in the literature that suggests that if you take these medications preventatively, it's going to help. Because the problem with taking them preventatively is that you don't want excess of something that you don't need. So, because it can lead to other things. So, you have to be careful about taking supplements. You should only take them if these things are deficient in your body. And the way you find out is you can do a blood test and find out if these levels are low. Vitamin D, calcium, you can take those if needed. But that would be my suggestion.
Alright, sir. And there's a question from Karti AR. He's asking, my aging mother has osteoporosis and is limping. What can be done about it?
Okay. Number one, osteoporosis. To those of you who don't know what osteoporosis is, basically thinning of the bone, the density of the bone reduces. And when that happens, people tend to have pain all over the body. Now, oftentimes, when the disease is so advanced, it doesn't happen just in one bone, it happens in all the bones, but when it starts, it's usually thinning of the bone, one or two bones in the body. It is possible that this pain is what's leading to the limping. So really, the pain needs to be addressed, number one. With as-needed medications, it can be addressed. Oftentimes, like Dolo or Tylenol is a safer medication to use. But that's one, right? That's just some kind of immediate relief. But let's delve into this a little deeper. Now, the bone is brittle, the bone is thin. Now, the other types of treatment that is also helpful in the long term is exercise. The more you weight bear, the more you walk, the more you weight bear on those joints, the better it is for your bones. The density of your bones increase. So that's something that you must do. So standing, walking, it's something that's very important. Even though there is pain, obviously that's why I suggested a short-term pain relief to help with the pain. But for long-term, walking is good for the density of the bone. The other thing is there is this test called DEXA scan that finds out what is the density of the bone. It's an objective measurement. You can have your doctor order the test, or I would say consult your physician and ask your physician if that is a good test to take if it's already not been taken, and find out how severe is the osteoporosis. Based on that, they will recommend certain treatment options, medications, supplements, vitamin D, calcium. They might also recommend medications such as biphosphonates. It is a class of medication which helps reduce the thinning of the bones. It helps bone formation. They do have some side effects, but you can always take those medications. Any medications have side effects, but they have more benefits than risks. So I would suggest speaking to the doctor, finding out if the scan is appropriate, and the doctor may recommend these following medications that I've talked about to help prevent the thinning of the bone and even to some extent help with the increase in the density of the bone.
Alright, sir, thank you. The next question is how can I reduce neck pain? That's all that's been asked. We don't have any other information.
Okay. All right. Again, neck pain, assuming that it is an elderly person, I was oftentimes because of osteoarthritis, especially if the pain is in the middle of the neck and to some extent on the sides, but if the pain is predominantly in the middle, that's often the case. And the other thing that you may also notice is the stiffness. Assuming that it is again, what would help the most is therapy. Unfortunately, there is no cure for osteoarthritis, there is only treatment. You can use medications for pain control when the pain is too severe. You can use certain physiotherapy exercises and some modalities, electrotherapy modalities to help reduce the pain. Those are some treatment options, and then assuming, let's say, if these things have already been done, then we can think of other ways to treat it. But really, this must be seen by a physician, evaluated as to what is the cause of the pain, and then appropriate treatment. Oftentimes, it is physiotherapy exercise that is recommended.
Alright, sir. And there's another question from Ajay. He's asking if there's any treatment for cervical spondylitis.
spondylitis. I'm assuming he's saying cervical spondylosis.
Oh yeah, sorry, cervical spondylosis.
Basically what that is to those of you who are not aware of that medical terminology, it's basically arthritis of the spine, which we had just talked about. Yes, there is treatment available, but there is no cure for a degenerative joint. There's no cure for that. So again, various treatments. Just gonna reiterate what I had mentioned earlier: medications, exercises, passive modalities. Actually, oftentimes heat can help. That's one thing that people often use. If the muscles are very tight, massage therapy can help. Some passive modalities, ultrasound can help. IFT, all those things can help to some extent. Let's say all these things have been tried. It's very stiff. Sometimes it's even causing pain down the neck to the arm. If you're seeing all those things and the pain is unbearable, there are some interventional procedures to the neck that can be done. These procedures are done by pain management physicians, and that is something that can be done as well.
All right, sir. Thank you, sir. And I think we're coming to the end of questions.
Mm-hmm.
But in a general perspective, when you're talking about joint pains in elderly, and we know that osteoarthritis is very common, what would you like to tell the individuals who are beginning the elderly phase, as in maybe in the 50s? What should they do from a prevention point of view? What would you like to say about that?
That's a very good question. That's actually a very good question, because it's a question that's so important, and the problem is so common that everybody must know. And this is the reason why. Just because someone has degenerating bone or cartilage on an X-ray doesn't necessarily mean that they will have pain. That's been clearly established in research. Okay, and most physicians are aware of that concept also. It doesn't necessarily mean that they will have pain. Now, people who, and obviously as we talked about, there is no cure for this. However, there is also, at the same time, there is no prevention either. Prevention for osteoarthritis. So just because someone developed it doesn't mean they will have pain, and pain is the major limiting factor in this situation. Who cares if there is something that's showing on the X-ray? What matters is pain and the disability that they have because of the pain. Right? They're not able to walk for a long distance. They're not able to walk up and down the stairs. They're not able to be as active as they used to be, and that's why exercises is the key for this particular population who are entering into 50s and 60s. They would have to be very active. What I mean by that is strengthening exercises have been shown to help the most with reducing pain in this population. So even if they have arthritis, it will significantly reduce the pain to the extent they may not even feel the pain at all. And so proper strengthening exercise, obviously walking and jogging and running and swimming is all good for the cardiac, but from a joint pain perspective, and also to be able to walk long distance, your muscles need to be conditioned, your muscles need to be strengthened. So general strengthening exercise is the key for this population, for whom the pain should be better controlled or even prevented from happening.
Alright, sir. Thank you very much, sir. We've come to the end of live session. Is there anything else that we'd like to convey to our viewers?
Really, what I had in mind is what I had just mentioned. That is, exercises is the key in a large number of population. I do understand that for a lot of them, they've done it and it didn't help. Well, the question is, was it done properly? So that needs to be evaluated also. But there's a lot that for whom it has been tried and it didn't really help as much, and then they have to seek other treatment options. But prevention is better than cure. You don't want to wait until your pain has become so severe. At that point, exercise may not help as much. So it's better to start these strengthening exercises, the generalized strengthening exercises from the very beginning, right? For people who are at high risk for this, who just started, who have some mild pain, to start with these generalized strengthening exercises to help reduce the pain significantly. And for those who already have this disabling pain and have not tried exercises, that would be the first step before going into any kind of surgery. And try that and see how you feel. And then, if it's not helpful, you can opt the option for surgery, right? So that would be my conclusion. Exercise is the key, particularly strengthening exercises, helpful for both individuals who have mild pain or no pain, who are at high risk, or people who have a lot of pain but have not really done it properly.
Alright, sir. Thank you very much. It has been very informative, I believe, for our viewers. A lot of questions on elderly joint pains, which is very common right now. Thank you very much for giving us valuable insight.
You're welcome. Glad I could be of help.